We will be studying about sutures, the tricks and types and the numbers of sutures. Okay, I'll try as much as possible to bring out some tricks so that it can be easier. First of all, starting with the numbering of the suture. So number 1 suture is the thickest and number 11 to 0 is the finest suture. One more thing to remember is that while studying about the surgical blade, we also studied that number 11 surgical blade has a pointed stab blade. So pointed and finest, these relate, so I thought of putting it here. Also, the number 11 surgical blade was used for incision and drainage. Alright, then okay, so coming back to the suture, number 11 0 is finest suture, and suture becomes finer as the number increases and 0 is added after the number. Okay, then similarly it was for the gauge as well. The 14 gauge had the largest bore, and 26 gauge, which was violet, had the thinnest bore. Like basically, if not thinnest, like it was a thin bore. So basically, as the number is small, the bore increases. Similarly, number 1 suture, the small number, is the thickest suture. Now thick suture is easier to handle, obviously, and the finer suture is difficult to handle as it can break and the fracture of the suture is more common. Okay, now coming to the types of suture. Now there are two types of suture: absorbable sutures and non-absorbable sutures. Among absorbable and among non-absorbable, we have natural and synthetic. So studying the first one, natural and absorbable, we have catgut. Catgut is a sheep gut derived tensile. Okay, first I'll tell you the trick, then I will go into the detail. Just remember, cat is a carnivorous, right? So she eats sheep's gut. This food, okay, there's some error, I'll edit it. Sheep's gut, okay. This food, the gut of the sheep, will give her tensile strength for at least 1 month or 28 days. But if she does not eat for the next 3 months, thinking that, okay, fine, I have enough food, for the next 3 months, that is the 90 days, the enzyme inside her will degrade and she will die. Okay, she hasn't eaten for 3 months straight. So catgut is sheep gut derived. She eats sheep gut, cat. What it will provide? It will provide tensile strength for 21 to 28 days. And the absorption time by enzymatic degradation, the degradation will happen if she does not eat for 90 days. Now, there is one more suture, natural absorbable suture, which is chromic catgut. That is also a type of catgut. So it was one was sheep gut derived and other is chromic catgut. This is with chromic salt coating. So now, and it has no role in surgery. How do we remember this? Cat sometimes likes to add chromic salt in the food. Okay, you don't want to eat a bland food, you want to add salt in the food. But does that salt provide you any strength? No. So it has no role in surgery. Then we have synthetic suture, absorbable. The first one is monocryl, then is vicryl, and then is BDS. Okay. Few tricks you have to learn is, anytime you see on or in, it means mono filament. Obviously mono is also one, right? So on or in is monofilament. So you see in monocryl we have on, so it is monofilament. In vicryl we have on, no. So it's not monofilament suture, it is a braided suture. In polydioxanone we have on, so it is a monofilament suture. Now coming to the non-absorbable suture, in this we have in. Okay, so in is also like on, so again this we have monofilament suture. Nylon ethylene, again you have on, so we have monofilament. So that was it. Okay, now coming back to the absorbable. So anytime you see cry, you know, if you cry, your gala or your neck will get, like your throat will, you will have sore throat. Okay, gala kharab ho jayega when you cry. So cry, anytime you see cry, it is glee. Cry, gala, glee, gala. Any other place there is cry? No, so there is no gala. Okay, so monocryl is polyglycaprone, vicryl is polyglactin, PDS is polydioxanone. Okay, I will tell you about the dye and all of that, but first let's study the monocryl. So monocryl is poly, गला से cry आ गया, so it will definitely there will be gly, poly, gly, caprone. On is there, so there will be definitely monofilament suture, and it is used in case of subcuticular suturing. If you know subcuticular suturing, it is cosmetically better because you won't see the sutures, and we use it on face, right? Because you want to have a better cosmetical appearance. So in a cutting needle is used because obviously the dermis is thick, so you cannot use round body needle, and thick needle is used 30. Why? Because this dermis on our face is thick, so you cannot use a fine needle, you need to use 30. So monocryl is polyglycaprone monofilament suture, subcuticle suturing on cutting needle 30. Subcuticle was 30. Now the question arises, how do we remember that monocryl has subcuticular suturing? So now you can understand the subcuticular suturing is cosmetically better, right? So you need to cry only once because while suturing, and then after that you don't have to cry because it is not being seen, it is cosmetically better, the suture is inside, so it won't be seen enough. So cry once, mono, cry, because subcuticular suturing is cosmetically better. So you know now that in monocryl we use subcuticular, we have subcuticular suturing, okay? And cutting needle and all of that you can understand, but that it's used in face, the thick dermis. Now coming to vicryl. Vicryl is polyglactin, cry, so gla will be definitely there, and there is no on or in or on, so it's definitely not monofilament, it is a braided suture, okay? It's a braided suture. In this the infection rate is high because braided suture, if you understand, it is something like this. So the infection, like sometimes the microorganisms can get stuck in that, so it can lead to infection, okay? Mono suture doesn't have such braid, so there is decreased chance of infection. So in case of vicryl you have infection rate high. Now absorption by hydrolysis is in 60 to 90 days. Uses are bowel, bladder and CBD. If you remember, the B's are for round bodies, B's structures, and the cutting or reverse cutting needle was triangular cross section, and it was used for skin, sheath and fascia, right? Cutting needle, like in case of hair, it is a triangular, it had a triangular cross section. I'll write here triangular cross section. Round body needle, obviously round cross section you have, and it is atraumatic, used for delicate structures, B's ones. It's okay. So bowel, bladder, CBD, these are delicate structures. In bowel and bladder we still use 30, and CBD we use 50. So bowel and bladders are relatively thicker than the bile duct, so we use a bit thicker needle, but it's still a round body needle. Any viscera or organ, usually we are using round body needle. So okay, so vicryl is polyglactin, cry, gla, braided structure, so infection is high. Then absorption is by hydrolysis and in 60 to 90 days, and uses are bowel, bladder and CBD. So overall we have learnt of absorption only 3 places, okay? We earlier learned in catgut, like 90 days was there absorption, in this also 60 to 90 days, almost same. And now next we'll learn, but we'll make trick for that, okay? And B for braided, B for bowel, bladder and CBD, and round body needle. Then coming to PDS, polydioxanone. On is there, so it will be definitely monofilament. Now it is di, okay? Di, so obviously it will be double of something, right? So double of what? Double of vicryl. So here it was 90 days, here it is 180 days, double of that, okay? Got my point? So the absorption here is 180 days, straight away double of vicryl because it is dioxanone. Then here monofilament suture we already discussed, and same use as vicryl, that's why it is double divicryl we are talking, but the function is also same as vicryl, just that is braided, so it becomes half you can tell because for making braid you have to make it double. So basically the size becomes half if you make anything double, right? So yeah, if you get my point, you get my point. And then for PDS it is 180 days because here it is monofilament suture, so anything will be longer, and in braided it will become shorter, half. So the time also becomes half. Infection rate also increases, and obviously same as bicycle, so uses will be also bowel, bladder, and CBD. So this was polydioxanone on for monofilament. Now coming, this was the absorbable suture, and we are discussing about absorption, hydrolysis, and all of that. So obviously it is absorbable suture. Now we won't be talking about absorption, so this is non-absorbable suture. Now it comes natural and synthetic. Natural is silk. Have you ever seen silk being absorbed? You wear silk clothes. Have you ever seen silk being absorbed? No. So it's definitely a non-absorbable suture, and silk is definitely natural. It is used for skin. 30. Okay. So first the trick. Silk definitely you wear on your skin, so that's not a question to be asked. You would definitely know, okay, silk is used for skin. Now you have worn a silk cloth, you do not want it to be get soiled, right? So you need to use fixed drain, and you need to anastomose your bowel so that your silk cloth is not soiled. So fixed drains and bowel anastomosis. Okay, now skin we already discussed. It was cutting suture was there, and subcuticular was used, and 30 was used. All of these are the same thing. Fixed drains, we use number 1 suture. You remember number 1 is thickest. Drain, for fixing drains are like thick things, so number 1 is the thickest, and for drain you need, it's a thick, so you need cutting. And for bowel anastomosis, again it's organs, so it's definitely round body. And bowels we already discussed, it is 30, right? Here we discussed. So here that was the natural one. Here bowel anastomosis we are using 30. Now we have synthetic, non-absorbable suture. Again, now is proline or polyproline. So monofilament definitely. Uses rectus sheath closure. In rectus sheath closure, we use a Jenkins theory. What is Jenkins theory? It is that minimum length required for closing of rectus sheath is 4 times the length of the wound. Why? To avert or prevent wound dehiscence and incisional hernias. So what do? Suture length raised to wound length, the ratio is 4:1. The suture is 4 times the length of the wound, right? This is Jenkins theory, okay? So, and it was used for rectus sheath closure. How do we remember the name? Not a good one, but maybe it would help. So Jenkins is a junk man, like he had a lot of things in his junk yard, and he had a lot of suture as well. So he thought, why not use a lot of suture for a small section of wound? So he started using 4 times. Junk man, or Jenkins theory, he started using 4 times the length of the wound. Okay, maybe it would help, maybe it would not. Vascular repair and anastomosis, we use round body needle. Again, the vessels, the organs, we use round body needle. All right. For aorta we use 20, thick, right? Thick. For femoral we use 40, and popliteal we use 60. So basically aorta we need the thickest needle, and popliteal thinnest. So 20, 40, 60. Aorta is the thickest. Aorta, femoral, popliteal. Alpha fetoprotein, maybe you can use that. Alpha fetoprotein. Okay. For mesh also, okay, so these, don't forget that these we are talking about synthetic, non-absorbable. So what was that? Proline. And in these, it was in proline. All of these was in proline. What was that? Rectus sheath closure using Jenkins theory, vascular repair or anastomosis, and mesh for hernia repair. Tried making a trick. So Jenkins was a pro man. Okay, he was a pro. Jenkins was a pro for proline. He had a junkyard, too much suture, so he decided to use the theory of 4:1. And then he was also pro in catching fish. Pro in catching fish using a mesh, like you understand the mesh of it, like fishnet appears like a mesh. So mesh for hernia repair. And but in junkyard he was hurt, because in junkyard there will be too much scrapes and all of that things. He is hurt, and that is for his vessels got damaged, so that is for vascular repair and anastomosis. Now we have nylon and ethylon, again on, so it's definitely on one monofilament. Nylon and ethylon, it is used for skin, fixing drains, and nerve and tendon repair. So it's almost the same as silk. If you know, nylon is also a material of cloth, but it's not a natural thing. It is, silk is natural, nylon is not natural, but still a material of cloth, right? So you again do not want your cloth to be soaked by a drain. So for skin and fixing drains, we have both nylon and silk. One extra thing is nerve and tendon repair. So maybe N for nerve, N for tendon repair. And also next is polyester ethibond. It's also used for skin and tendon repair. Ethylon, ethibond, all of these are skin and tendon repair. Skin, again polyester is also a type of cloth, so again silk, polyester is also a type of cloth, so skin. So what do we have for skin? Types of clothes, so we can remember. Silk, which is natural, nylon, which is not natural, synthetic, and polyester, which is again not natural. These are used for skin. So among these, silk and nylon are used also for draining sutures. Then polyester and nylon, these two are for tendons. Some things you got to remember. Steel, we know it's closed sternum after cap G. So that was it. And natural sutures overall, they have more tissue reaction and inflammation. So that was it.